Welcome to Biomanscape. Today we are going to know how immune system react on inflammation. When an immune system react on inflammation, it is a part of body's natural defense mechanism to protect your body against any infection, injury or harmful stimuli. So, what is inflammation? Inflammation is immune system response to any infection, injury or harmful stimuli. So, main goal is to eliminate the cause and remove the damaged cell and start the healing process. So, first what happens? The immune system detect the damage or infection in your body. So, special immune cell like macrophages, mast cell and dendritic cell, it detect the danger signal such as the pathogen, bacteria, virus, etc. Then damaged tissue and toxin as well. So these cells release inflammatory mediator like histamine, cytokine and prostaglandin. So the histamine, cytokine like interleukin 1, interleukin 6, then tuber necrosis factor alpha, and vasodilation and increasing permeability. The blood vessel near the affected area where there is an injury, at that area there are blood vessels. So they are widened. Vasodilation, that is known as the vasodilation, it occurs and it causes some redness or heat, and the blood vessel walls it become more leaky and allow the immune cell and plasma to enter the tissue and cause swelling. So immune cell like neutrophil, monocyte and T cell, they are attached to the site through a chemotaxis which guide the movement by chemical signaling. Then neutrophil, they arrive first and start the phagocyte and eat the bacteria and debris. Then phagocyte like neutrophil and macrophages that engulf and destroy the bacteria, dead cell and foreign particle. They also release toxic enzyme and reactivate the oxygen species to kill the pathogen. Then on the threat is removed. Once the threat is removed, the antigen inflammatory cytokine like interleukin 10 and TGF-beta are released, and macrophage switches role to clean the debris and promote the healing. So tissue repair begin, new cell grow and blood vessel are repaired. So if infection is present, if a pathogen causes the inflammation, the adaptive immune system is active. And T and B lymphocyte create memory cell which ensure a fast response next time. So what are the steps? First, it is detected. The danger signal trigger immune cell. Then inflammatory signal like histamine, cytokine are released. Then vasodilation occurs, the blood flow increases, and there is where there is a swelling or there is a redness or heat which is caused. Then immune recruitment, the neutrophil macrophages are arrived, and pathogen and debris clear, that is the destruction. Then healing, anti-inflammatory signal, tissue are repaired. So inflammation is a protective in short term, but chronic inflammation is long lasting. It can lead to diseases like arthritis, heart disease and cancer. So what do we get? Inflammation is the body's protective response to infection, injury or harmful stimuli. So what is the aim of inflammation? To eliminate the initial cause and remove the damaged tissue and initiate repair. So there are two types of inflammation. First is acute, second is chronic. So acute one is rapid onset, which it is of a short duration, which take minute to day to recover the repair of that particular area where there is a infection or damage. It is marked by a fluid or neutrophil accumulation. And chronic one is a slow onset, long lasting, involve the lymphocyte, macrophages, tissue destruction and fibrosis. Then what is a cardinal sign? The cardinal sign, there are 5 classical signs of acute inflammation like redness, heat, swelling, pain and loss of function. So the redness is due to vasodilation, heat is due to increasing blood flow, swelling is leaking of plasma, and pain is the chemical mediator stimuli nerve, and loss of function is due to the pain and swelling. So there are various terms for that particular redness, that is rubor. Heat, for heat it is calor, for swelling it is tumor, for pain it is dolor, and for the loss of function it is functional lesa. Then there are various types of inflammatory responses. First, the injury is recognized, the infection is recognized by a tissue, resident macrophages, mast cell, etc. Then there is release of mediator like histamine, cytokine and prostaglandin. That is the vasodilation and increasing the permeability. Then the fluid and immune cell move into the tissue. Then migration of immune cell like neutrophil first, then macrophages, and then lymphocytes. Then elimination of threat, that is why phagocytosis, ROS, and enzyme. Then resolution, where the anti-inflammatory signal promote the healing. So major inflammatory mediator are histamine, where its function is to vasodilation, increasing the permeability. Prostaglandin, its function is to pain, fever, and vasodilation. Whereas cytokinin, it activates the immune cell like interleukin 1, interleukin 6, and TNF alpha. Then bradykinin, its function is to pain and vasodilation. Chemokinin, its function is to attract the immune cell, chemotaxis. So important immune cell like neutrophil, macrophages, mast cell, and lymphocyte, they are important. So neutrophil is the first responder phagocyte. Macrophages is the phagocytosis, cytokinins, and secretions, in that it is important. Mast cell releases histamine, and lymphocyte in chronic inflammation, they are important like in T and B cell. So what is the outcome of inflammation? Complete the tissue healing, and if cause persistent chronic inflammation or abscess formation like pus filled cavity or fibrosis, that is scarring if damage is served. So chronic inflammation features, it involve the mononuclear cell like macrophages and lymphocyte. It leads to tissue destruction, fibrosis, and antigogenesis, and seen in autoimmune diseases, persistent infection, and prolonged toxin exposure. So clinical example like acute and chronic types, it have various condition. In chronic like rudimentary arthritis, tuberculosis, and asthma, it is chronic type, whereas acute is appendix is an acute type of example. Then anti-inflammatory drug aspirin, ibuprofen, it block the prostaglandin synthesis, whereas the corticosteroids which inhibit multiple inflammatory pathway. So 5 main cardinal sign of inflammation. Why does a cut turn red, swelling up, and feel warm and hot? These are not random reaction. They are the part of your body's ancient and powerful defense mechanism. They are known as the inflammation. So here the redness, that is the rubor, the first and most noticeable sign of redness or rubor is latent, and this happens because of vasodilation. That is the blood vessel in the injured area widened and allow more blood to flow through. And since the blood is red, more blood means more redness. And the key chemical behind this are histamine and prostaglandin. Whereas the heat, that is the calor, next is the calor, which means the heat. And why does an inflamed area feels warm? Again, it is due to the increased blood flow, and the blood carries heat from the body core to the affected site. Also, immune chemical like interleukin 1 and TNF alpha can cause fever when inflammations become systematic. Then tumor, the swelling. The third sign is swelling or a tumor. Doesn't confuse this with cancer. Here it simply means a bump or enlargement. The swelling happens when a blood vessel becomes leaky, allowing fluid, protein, and immune cell to move into the surrounding tissue. This fluid buildup is called edema, and it's mostly caused by histamine and bradykinin. Then there is a pain, that is a dolor. So fourth, and we have the dolor or pain. The inflammation often hurts, and here's why. The chemical like this prostaglandin, serotonin, it stimulates the pain receptor in the area, so it allows the swelling, put pressure on nearby nerves, making the pain worse. So the pain serves as a purpose, and it tells you to rest and protect the injured area. Then there is a loss of function, that is the function of overlooked sign of the function. That is the loss of function when an area is swollen, painful, and inflammation. It can work normally. For example, a swollen joint may lose mobility, or infectious lungs may have trouble in breathing. So this is your body's way of forcing you to rest the injured part, so it can heal. So now we know that that these are the 5 means: redness, heat, swelling, pain, and loss of function. These are the 5 features and essential clues that your immune system is working hard to protect you. So next time you get a cut, observe your body's response. It's not just discomfort, it's a careful, coordinated biological defense system at work. And now that you know the science behind the 5 cardinal signs of inflammation. Thanks for watching. Do like, share and subscribe.